Good morning, friends. Pradeep Pendyala. After a long gap, I am back with one of the academic lectures of mine. It will be very, very brief. Today, I am going to talk everything about aspirin. I'm sure you must be using aspirin left, right, and center. Aspirin is nothing but acetyl salicylic acid. It's an NSAID. Okay, it's a medication used normally to reduce fever, inflammation, and pain. It has a specific inflammatory property, to reduce inflammation by giving aspirin, and is definitely used to treat Kawasaki disease, pericarditis, and rheumatic fever. Well, more if you want to know a little more than the things which you already know. I'm sure you know that aspirin is used for long-term benefits in heart cases, ischemic strokes, and blood clots in people in high risk. For pain or fever, typically we begin with the tablet or whatever form aspirin is given, and the effect starts within 30 minutes. Aspirin is nothing but an NSAID, non-steroidal anti-inflammatory drug, and it works similarly to other NSAIDs, but it also suppresses platelets. I'm sure you know so far. Let's talk about something more. The adverse effects, again, it causes gastritis. Side effects includes ulcers, stomach bleeding, gastric, because of gastric ulcer, and it can worsen asthma. Bleeding risk is there definitely. Those who are old and who are alcoholics or who are already taking other NSAIDs and such, or some other anticoagulants, for such people, bleeding risk would be there by taking aspirin. It is not generally recommended in children with infection because of the risk of Ray's syndrome. Have you heard of Ray's syndrome? It's a problem with the brain which causes even death. Mainly it affects the brain. It causes convulsion, and it causes respiratory depression, and it can cause death also. Mainly related to brain, loss of personality or change in memory, personality disorders, and those who survive, chances are very less after Ray's syndrome. Okay, so let's talk something more about it. It shares the platelet aggregation inhibition like any other NSAIDs, and it causes bleeding, time prolongation like any other NSAIDs, and you must know the antithrombotic effect lasts for almost a week or a little more. That's the specialty of aspirin compared to other NSAIDs. So because of that reason, it is preferred drug in prophylaxis and treatment of angina, myocardial infarction, and ischemic strokes. Dose, I'm sure you know, 75 to 150 milligram a day. Well, you must recall that a small dose of aspirin or indomethacin, is used to close the PDA, patent ductus arteriosus, in the fetal circulation. Normally it closes of its own spontaneously, but if it doesn't, then you can try a small dose of aspirin or indomethacin for closure of ductus arteriosus. For the closure of ductus arteriosus in fetal circulation. Now, it should not be used during pregnancy, especially during term. Why? It can retard labor, it can delay labor, or it can increase the risk of postpartum hemorrhage. So be very careful using left, right, and center for short, simple reasons of fever or body aches or something. Don't be impulsive giving aspirin saying that nothing will happen. It can cause many problems. And some people have even hypersensitivity to aspirin. So when the hypersensitivity takes place, there can be hemolysis which can occur, especially in people who have G6PD deficiency. G6PD is glucose 6-phosphate dehydrogenase deficient individuals. Overdose can manifest as vomiting, hyperglycemia, petechial hemorrhages, and convulsions and coma. It can cause even death due to respiratory failure or cardiovascular collapse. So be very careful while prescribing aspirin. Thanks for patient listening. Have a wonderful week ahead. This is Colonel Pradeep Pendyala, Professor of Anesthesiology at ASRAM Medical College, Eluru city of Andhra Pradesh, India. Take care. Until next time, take care. Bye-bye.